Well, the COVID-19 lockdown has had a negative impact on many sectors. Some people living with HIV struggle to gain access to treatment during the lockdown period. But the Aurum Institute has been assisting with delivering chronic medication, including antiretroviral treatment, to people at their homes. The aim of the project is to limit the numbers at healthcare facilities amid this pandemic. Let's discuss this further now with the organization's Dr Ntombifikile Mtshali. Doc, a very good morning and thanks so much for your time. Just give us a clearer picture of the full extent of the impact of COVID-19 on these services, especially access to HIV treatment.
Good morning, Uveka, and your viewers. I think, firstly, it's just very difficult to talk about anything in 2020 without mentioning COVID-19. And as we observe World AIDS Days, we remember the people that have passed due to COVID-19, but also due to HIV, but also salute the frontline workers in all our facilities. The impact of COVID-19 on the healthcare system has meant that, you know, especially at the beginning, we saw a lot of clinic closures due to perhaps a case that has been identified. So we had to be able to figure, you know, in total, I think in this year, in the 4 districts that we support, we've lost about 1,000 clinic days. That is a massive impact in terms of people who then rely on the facilities, public healthcare facilities for treatment. So that's why we actually came up with the concept of home deliveries, which was a point to try and reduce the number of people that are coming to the facilities. And we're tweaking this particularly for all chronic medication, but also for all people that are living with HIV, with chronic diseases. In terms of the impact, I think we've seen some statistics as well around how testing numbers have regressed for both TB as well as for HIV. We understand, and really the plan, the aim right now is to figure out how we are managing the 3 pandemics, because we will need to be able to look at it in that way, because they are coexisting now, and we sort of have to figure out a way of working, still being able to deliver our best services, but also making sure that we are, we are still mindful. Part of the support that we've provided also has been to make sure that the facilities are ready in terms of infection and prevention and control, activities and measures around mitigating the impact, and really just decongesting the patients as much, the facilities as much as possible.
Yeah.
In
terms of sorry, you can carry on.
No, carry on. No, I was just going to mention that one of the challenges that we are seeing, particularly right now, is even though we largely have at the moment, South Africa has about 8 million people living with HIV. Most of them are women. About 5 million of them are women, and the rest are men and children. So men make up 2.5 million of people who are living in HIV. What has been scary, particularly, are the statistics that we've seen that are showing that even though only roughly 2,000 new infections is affecting men in this current environment, more than half of the 74,000 HIV-related deaths are because of men. So we are seeing some gaps in the program, and that's where we are really, one of the focus and the attention that we are paying a lot of attention to is particularly men and young children.
Well, Doc, in terms of exactly what was happening on the ground, and I'm sure in your deliveries you were able to talk to people and find out exactly what setback there has been for their health. This period of lockdown, has it really set an individual back really far, and have they gotten sicker over this time?
I think part of the strategies has been to prevent precisely that. So even the home delivery component has been to make sure that patients are still maintained on treatment. The people that are due for viral loads, they are still being seen, and making sure that we are minimizing the impact. Yes, we've had some reports where patients had deliberately stayed from the facilities because they are scared of potentially contracting COVID-19. So we know that it has meant that their viral loads are not being done. They are not being switched accordingly to the TLD regimen that we are We started rolling out a couple of months ago. We know that this has been a really difficult time, which is why there is a role, particularly for our organization and other developmental partners, to make sure that we are coming up with innovations, because we can no longer deliver health the way that we are accustomed to, in the way that we are used to and are comfortable with, but it really has to be more patient-focused and making sure that we are looking after the patients at the end of the day, as we are, all of us trying to figure out how to go about and navigating this particular pandemic.
And Doctor, if I can ask you very quickly, what are the obvious lessons we've learned, the things that we will have to do forever after this because of COVID?
I think one is COVID-19 came when we were not prepared. We didn't know what it was. It's a novel disease. So we've had to quickly adjust. So it's about, the overall health system, how robust it is. So one of our interventions is around health system strengthening. And really, we've seen the almost collapse of the healthcare system due to the COVID-19, people not being able to access facilities, etc. So we really, I think the lessons we've learned is that I guess what we've done very well is that we've been able to think on our feet. We've been able to act very swiftly in where challenges have been presented themselves, even though it was something that we've never dealt with before. So I really think that's something that the government and the developmental partners have certainly done well. But also is then to be always in a state of readiness. And that's why I speak about the robustness of the healthcare system, because really the healthcare system must not be shaken by pandemics. We need to be able to figure out, and we have to have a response or a readiness or preparedness in terms of how do we then deal with particular pandemics like this, because we know this is not the first one. I mean, we know it's the first of many, and according to the science, we're seeing that this is basically what we need to be accustomed to. So infection prevention control, as we should have been doing for TB, stepping them up, just being able to educate patients. I think one of the other issues has been the fact that our staff or staff in the different facilities have not, we had to deal with the morale issue. So already interventions around that needs to be stepped up about how do we boost people's morale, the healthcare workers that we are relying on every single day to be at the front line, and they are the backbone of the healthcare system.
And not to forget about the other chronic illnesses, that not to let them fall by the wayside. Thank you very much, Dr. Ntombifikile Mtshali from the Aurum Institute there.